Hey everyone, it's Dr. Martin again with Dr. Martin Live with Einstein Peds. Thanks for being here. Excited to have you. I'm fresh off July 4th weekend and finally having a little time off. Hopefully everyone got a little relief over the weekend as well from the real world and did it safely. So today I'm really excited. We have a special guest today to speak with us about from feeding issues, particularly in the infants and toddlers. But before we begin, I do want to remind everyone that when I do interviews and we do it this format, in order for us to see your comments or your questions, which we would love to have answered during the live feed, you do have to go to that site that you see at the bottom of your screen and grant permission for Facebook to allow your comments through and allow your information through that way. So I'll keep posting that from time to time. It's on the Facebook page as well if you lose it here as I put it back and take it away, and I'll keep reminding you of that. But we'd love to answer your questions, so this is the way to do that. And until Facebook sort of goes back to allowing interviews through its natural interface, we have to use a third-party app, and this is the way we're able to get comments through. So I will keep putting that up from time to time, but on to the show. So today we have Darcie Scheffler, who is an occupational therapist locally. She grew up in Baltimore, Maryland, just over and beyond a little bit. She went to college at the Quinnipiac University in Connecticut. I hope I said that right, where she earned her bachelor's degree. She also spent time in New York practicing occupational therapy before moving to Virginia in 2003, where she now is at the Children's Therapy Center since that time, happily seeing many of our patients in our practice and other practices in the region. So welcome, Darcie. And you are about to be on. There you go.
Hi, everybody. I'm happy to be here. Thanks for having me.
So we really appreciate you taking the time out, because I know we're all busy and I'm sure you're as busy, although I imagine you're practicing more virtual these days. I didn't ask you that. Are you doing a lot of virtual or are you doing in person yet?
We're doing a combination. We're certainly seeing families wherever they're comfortable and whatever is best for their individual child. So we are doing some telehealth visits, and we are slowly reopening the center and gaining more and more hours as families are interested in coming back. And of course, we're practicing all the safe measures and taking temperatures and wearing masks and gloves. And we ask that the families do so as well. So we're open and ready for business.
It's the new norm, right?
It is.
Face mask and temperature checks.
And the kids are doing great with it. I am so impressed how the kids are handling it. They're doing a really great job.
They are. I've been surprised in the office too, with rare exception, kids over 2, that's our rule. Over 2 wear mask, under 2 do not. Yeah. Kids have really bounced. I mean, that just shows their resiliency, right?
Yes. Now with feeding therapy, it's a little different. We can't really wear masks when we're eating, so.
That has been a problem. I can see where that would be a challenge. Well, I want to thank you for being here.
Sure.
I'm going to jump in. So I love this topic, and I have to say I moved to the area 2 years after you did in 2005. And things were a lot different then, and I've definitely noticed a lot more questions about feeding. And in the past, and a lot more problems, a lot more challenges that we're experiencing. And it's just, different population of kids and parents, and the needs have changed. And so this is a hot topic. It's in the beginning when I was in practice, I don't think I received as many questions. I had to push the agenda, and people seemed more knowledgeable, I think, in some ways, and had more help doing some of these things. And now there's a lot more questions, a lot more help needed, which is what we're here for. But I do think there's been more challenges for us as primary care providers as well. So one of the things I remember when I first started in practice, I wanted to ask you about is about baby-led weaning. So when I first started, I think most of us in the pediatric, at least general pediatrics, kind of were hesitant to say okay to this. It's interesting, there's now been some research. I know there's a large-scale Australian study looking at safety, because I think for us as pediatricians, we're risk averse. I know you probably are too in your world. Mm-hmm. And we really, I think, pushed away from this because of the lack of information about it. I think there's more now, And I've shied away from, and actually, I'll tell you, I actually feel like a lot of these kids downstream are actually doing better with sensory stuff than the kids who are not using baby-led weaning. So it's been an interesting, I don't know if you're seeing that as well, but how do you feel about baby-led weaning? This is a question we get asked a lot.
Sure. I think there are many layers to it. First and foremost, I think any parent should make sure as soon as they find out they're pregnant that they find some way to get CPR trained for infants and toddlers. I think it's just a really important set of skills to have as you're raising a child, and certainly as you start feeding them solids, to know what to do in case. Certainly we don't want those things to happen though. So that is my first and foremost, and something I tell all of my families. I don't think that there's a hard and fast answer. Is it okay? I think it's individual for every child. I certainly think that if you have a child that has any developmental delays, any motor delays, it may not be the best choice for your child. To safely eat, your child needs to be able to sit up against gravity and maintain their core stabilization, maintain head and neck control, and maintain an upright posture. Certainly when we feed an infant or a child, they're usually in a high chair or booster seat when they're eating solids. So they do have back support usually, but we want to make sure that they have the core control and they have the stability where if they lose their balance a little bit or turn their head to look at mom walking by in the kitchen, that they're not going to have a piece of food in their mouth and that get stuck somewhere because they have to control their body. So that is first and foremost. I think the other thing that, you mentioned that you've possibly seen decrease in sensory issues with this is people that tend to use baby-led weaning tend to be more open to what they're offering their child in terms of food. Whereas people who are traditionally following puree, stage 1, stage 2, and, progress up, tend to be a little bit more structured in what they're giving their child. So I do love the concept of exploring food and exploring different textures and exploring what our mouth does, what food does with each texture, and what our hands touch with each texture. So I do like the idea of, if the child reaches out for something that's on your plate, allowing them to experience that in a safe way, of course. So I think for a typically developing child who doesn't have any developmental delays, it's certainly an option that parents can look into if they're interested in it, but I don't think it is necessary for each child, and I think it should be done with just a view of, is this safe and am I comfortable? The last thing I would want is a parent to start that but feel really anxious about it, because your child's going to pick up on those anxieties and then they may feel anxious about eating, and that could cause issues down the road as well.
Sure, that makes sense. Now, to follow up there, so we're kind of talking about the introduction of foods here for a first time. The Academy of Pediatrics has, and it's been this way for a while, the recommendations usually fall somewhere between 4 and 6 months for introduction of solids. I've noticed more of their literature has started to push towards 6 months. They often leave out the 4 months. Mm-hmm. How do you, so that's, obviously there's not a hard and fast with the age necessarily, but you gave a little bit of information. Maybe we can bring that out, when to start solids and what the role of that is.
Sure. I tend to lead more towards the 6 months as well. I think kids have just more development under their belts. Between 4 and 6 months, lots goes on in that little body. And they're just gaining so many skills and strength and control. I think exploring is really, really, really important. One of the things we see a lot in kids that have feeding challenges is that they somehow skip the step of exploring with their mouth, and they may not have put rattles or safe toys in their mouth to explore. So that stage is really important. And it's very common that we see that kids kind of skip that. I'm not sure if that's because we're just careful and we don't want kids to put things in their mouth, but it's a really important stage to start. When we're born, our gag reflex is towards the front of our mouth. And as we explore through putting toys in our mouth and touching things with our mouth and getting our teeth or gums brushed, that gag reflex moves back and becomes a protective safety response for choking. But if we don't desensitize that gag reflex, any food is going to feel scary to us when we put it in our mouth, and it can cause a lot of feeding challenges. So I like to let kids develop as much as they can, develop all the strength, develop all of the skills that they can. Bringing their hands to their mouth for self-feeding is really important from day one of feeding introduction. I like kids bringing stuff to their mouth and exploring. Now, in every situation, there might be, weight issues where we have to look at, do we want to start earlier because they're not gaining the weight they need just from formula or breast milk, or they're not sleeping through the night. And so those are, individual cases that we might want to speak with the physician about and decide if going earlier is better for them. But I do tend to lean towards the later 6-month area too.
That's good to know. And I want to highlight some things that you said there because I think they're so important. Like, at no point have you talked about calories and the nutritional aspect of eating in the beginning, which I think is interesting. And I think it's important because a lot of eating solid food in the beginning is about the sensations, the experimentation of putting things in the mouth, the oral motor function of how we do that. And I think a lot of people get caught on getting calories in, filling up the kid, either because they're hoping that it'll help them sleep through the night, which the evidence is weak at best to suggest that. And actually, there's probably more studies saying it doesn't do that. But, and so I usually don't use it as a means of helping with sleep training. It's really usually separate issues that are going on with sleep. But I think really, really important point to bring out of this again is the sensory parts of letting kids explore with their mouth and putting things in is important safely. I love the CPR recommendation, which now the hospital Inova does a lot of for the parents. I don't know if you know of other places, but Inova is usually the place that we recommend the families get it done.
I haven't heard any feedback specifically on where people are getting it.
Okay.
And to your point about the oral exploration, a lot of times the first things that I tell parents to use are for non-nutritive exploration. We'll give infants, this is by far a safety recommendation, always with caregiver supervision, and babies that really don't have any teeth yet. Solid big raw carrots or celery sticks to chew on, to gnaw on, so that they're getting that to the back parts of their mouth. Their jaw is learning how to bite down and gain stability there. So using food for non-nutritive exploration, but it's really going to build up their skills for them to be able to eat down the road.
Yeah, and it's really, from a pediatric point of view, it's like for us, it's like we're not expecting most of the calories to come for months from food. It's really about these other aspects of it. So I think that's really a good takeaway. All right. I'm going to move on. So I think we kind of get the introduction of stuff. When do you, and I know this wasn't on our list, but I know you'll be able to answer this. When do you expect kids, how do you guide parents when they're increasing the difficulty of the food, of how solid it is, going from more, puree to the more, chunky and thickening? How do you guide families, or what would you say to families in order to know when to do those changes? Because I get that question a lot as well.
Sure. Well, as the dentition is developing and teeth are emerging, I always tell parents, like, if you're giving a child food and they don't have teeth yet, or they don't have teeth in the back especially yet, it should be able to be squished between your fingers, because that's basically what the gums are, right? So if you can take, a boiled carrot and squish it between your fingers, it should be safe enough for them to mash up within their mouth. So I usually start with purees. We then move towards like the thicker purees. The stage 3s are always an interesting stage. I have heard through some of the continuing ed courses I've gone to that stage 3s are a bit of a marketing ploy by some of the baby food companies. A lot of kids don't do well with stage 3s because there's chunks and there's liquid, and the chunks get stuck or they get spit out. So I tend to go stage 1, stage 2, and then I tend to go towards what we call meltable solids. One of my favorite inventions, and I don't know how people did feeding therapy before it, is the veggie stick.
Yeah.
The veggie stick or veggie straw, which you can get at any grocery store, are long, probably about this big, dehydrated pureed vegetables that are a crunchy snack. And I love long sticks when kids are learning to eat because they can move them within their mouth easily and they don't get lost by a small puff disappearing in their mouth. And they dissolve very, very quickly. So if a piece does get broken off in their mouth, they dissolve very quickly and can easily be swallowed. So those are one of my favorite go-tos, and I use them almost consistently with any kid not allergic to the ingredients in them.
Yeah.
And then, so I do a lot of meltable solids. We'll do the veggie sticks. We'll do eventually the puffs. Once I know that they can, handle a small piece of something in their mouth, we might do the puffs. We then progress. Cheerios are actually not exactly a meltable solid. They don't dissolve as well as some of the other ones, but you can progress to Cheerios or butter crackers or those types of things that break off and dissolve pretty quickly. We don't want things that are going to break off and what I call explode in your mouth, like have tons of crumbs, like a Ritz cracker. If you bite it, it has a lot of crumbs in your mouth, and that could be very scary for kids because they don't know what to do with all those little pieces on their tongue. So we have to work up to that for some kids. And then to soft table foods, things like soft cheeses that, they can mash within their teeth, really soft boiled vegetables or avocados, things like that. And then we get to more firmer textures or combining textures and kind of progress through that.
Great. No, there's a lot in there.
Yeah.
And I like what you didn't do. You didn't say what age each of those things. That's really different to each kid. And I think that's another piece. I think I get a lot of questions asking for a chart.
Yes.
To say when to do what, because I think, we're Northern Virginia. I'm like this too. We all have our spreadsheets and we're referring to and checking our boxes and going through this. And unfortunately, it doesn't lend well to raising a child.
Right, right.
Kids don't follow charts.
No.
And I think it's more important to look at how your child's doing with the current stage and making a decision based on that. And I think that's really, really important. I love that you didn't say anything. I was waiting for you to do it.
Nope.
Good.
I don't follow charts when I do any type of therapy.
Good. All right, so that lends us as we're moving forward. I'm gonna try to touch base on some of the toddler stuff because I know I get a lot, and I know there's people out there had some questions about the picky toddler. It's everyone's nightmare. Doesn't have to be a nightmare, but it can be. So a lot of kids I'll find, you get to the table food, they're excited. They're seeing parents do things. They'll imitate what the parent's doing, and it's an opportunity. But somewhere along the way, all of a sudden that stops for a lot of kids. What advice do you have for families dealing with that picky toddler who all of a sudden, I get the story, it's like, oh my God, he ate everything. And then in the last month, he eats like 3 things now.
Right.
Yeah.
I feel like, we need to appreciate that this is a very typical stage in development, and toddlerhood is all about gaining independence, asserting what we want to be independent on, and a lot of times that becomes a power struggle during mealtime. One thing I've learned is I will never win a power struggle over a toddler. That won't happen. What I think parents need to remember is that there's only so much you can control. You can control what you give your kid. Your kid can control what they will eat. So we find it really important for parents not to force feed their children. It is something that can cause many challenges down the road. And it is really up to the child whether they are going to eat it. You also don't want to become a short order cook, though. You don't want to only provide those same 3 foods every day for your child over and over, because that's not going to help them build their repertoire. One thing that I have to give parents a lot of support on sometimes is that it's okay, as long as there are no other underlying medical situations going on. It's okay if a meal does not go well and your child does not eat much during that meal. They will make it up in the next meal. One myth, however, is that a child will eat when they're hungry. We do find that a lot of kids that have feeding issues will not necessarily eat when they're hungry. And we don't want that to cause weight loss or dehydration or any other issues. So if you are concerned that your child is not gaining foods, it definitely would be a reason to come for an evaluation. It is very normal for toddlers, and then through the lifespan, even as adults, for us to do what we call food jagging, which is, you may eat one thing over and over again. Oh, I really love this recipe, I'm going to make it over and over again. But then you got to get sick of it, right? You don't want to keep eating it. That's very normal. And kids do this all the time. What becomes atypical is if it doesn't get replaced with something else that has similar nutritional value. So if they, like bagels, let's say, and they eat bagels all the time, and then all of a sudden they stop eating bagels, but they have other carbohydrates and starches that they're eating in their diet, then that's okay. If they're only eating 3 foods and they stop eating bagels, and now you're down to 2 foods, that's a bigger problem. So we try to have kids have a variety of, 8 to 10 foods that you can kind of rotate through their repertoire in each kind of food group. Carbohydrates, proteins, fruits, vegetables. That's kind of where we want children to be, that you can rotate through those types of foods.
So that's actually a good question. So you have those foods they like, should you always be mindful? I mean, so I see some parents that always at the meal that bagel's offered. You'd recommend against that then?
I would. And certainly if a child is very picky and we're working with the child, or if they have such limited foods and you can't progress them, right now that's fine. But that's when I would definitely seek assistance to help build from there. But if you have a child that has preferences, I would not offer that same food at every meal, and tell the child, maybe we'll do that tomorrow, or maybe we'll do that for dinner, or, have different options. Maybe have something else that that they like during that meal, but that, isn't that like favorite, I need this food.
Okay, great. And I want to hit on this. I think this is super, super important, because I see this all the time, and you're probably getting referrals from us for this as well. And this starts a lot of times in infancy, where the focus is on that getting calories and nutrition. And so people start using distraction, whether it's a toy, TV, very early. I've seen it really down into the introduction of solids.
Yes.
But a lot of it's used in toddlers too, when they start to get picky. And then, so just distractions of things. And almost like a force feeding, where the kid's really not engaged in what they're eating, or pressure put on the child. And so I'm hoping you can back me up on this, but I've never seen a good outcome from that. Only bad things. No.
Yeah, and there are certain feeding programs that still use that strategy, and it is something that we 100% do not encourage. It can start even with a bottle or nursing, that babies need to be distracted, or so parents think need to be distracted to eat. And what happens there is we're completely disconnecting the cognitive element from eating. And if we don't know what's going in our mouth, we're not learning to eat. We may be consuming calories, but we're not learning to eat. So it is extremely important that we work towards decreasing the distraction. If that is the only way your child is eating, then please look for help, and we can definitely help you work on that. Because they may eat something fine if they're, staring off at a TV screen and you put it in their mouth. They may not realize even what they're doing. But then if they go to put it in their mouth, they may even gag on it. Because they're touching it and they're reacting to it. So we definitely need to work on the skills to learn to eat versus just consume.
Yeah, we do see it. I mean, it's a cultural thing as well. So you definitely see generational, where you have grandparents or someone else caring for the child doing these things. I like to use the analogy. It's like us sitting and watching TV and snacking, and it's the same thing. It's the same
Mindless
cognitive.
eating.
Yeah, it's mindless eating, and it's hard because I'll have a conversation with families, and I think probably I have found over time it's not motivated them. Is that giving the, I mean, there's actually research following that style of eating and obesity, right?
Mm-hmm.
And it's hard to imagine this skinny kid being an obese kid later because of it. But I've been practicing long enough now. I've seen it.
Yeah.
And you wouldn't imagine that it could happen, but it does. It's unfortunate in those cases. But yeah, I really do try to tackle this early, but it's really important. And ask us as pediatricians. I mean, if we're really struggling, you guys are a great resource. We'll help families sort of relearn how to get food into the child's diet in a more healthy way.
I think one other thing just on that is I think that parents tend to use distraction because they're in survival mode. And what I've learned in my practice is that feeding is probably one of the most emotionally taxing things that your child can have a problem with. Your child needs to eat about 6 times a day, which means you need to deal with it 6 times a day. And if that is a challenge, and all you want your child to do is be healthy, and getting food in them is what keeps them healthy, and if that doesn't work well, I just seen it take such a toll on parents and the children, and it can be something that we can help you make a positive experience versus a survival experience.
Yeah. That starts right from the beginning too, even with breastfeeding. There's so much tied into how you feel as a parent based on what you can. I mean, I can't tell you how many times like people are like, oh, my kid eats, they're proud. They're like, my kid eats all these things, right? So much of our success and how we feel about our parenting gets tied into that. And it is time consuming.
Yeah.
Oh man, it's time consuming.
Yes.
It's hard. So we hear you. No, it's tough for you, the parents out there. I mean, it's not easy, we know, but again, we're here to help and definitely as a resource. And I think sometimes people, as much as we're getting more questions on, I think sometimes people do forget to ask us that this is an area that we can help counsel you on as well. So I think that's important. Oh man, where did the time go? It goes quick. I want to, and this is a broad question, but I always like to sort of end when I'm talking to people about certain red flags. And I would kind of ask you, what kinds of red flags should parents be looking out for where like, this is no longer normal, they should be seeking help either through us or through you?
Right. I think some of the big things I see is if your child is not progressing to different textures, that's definitely a challenge. Or if you notice certain textures that they have trouble with, whether they're keeping food in their cheeks, we call that pocketing food in their cheeks, having difficulty, it's taking a long time for them to swallow a type of food or any foods. If there's any coughing while eating or drinking, that is a very big red flag. We don't want anybody having what we call aspiration pneumonia, where the food goes into their lungs versus down to their stomach. If your child, if you're struggling with meals at all, I feel like there's sometimes some simple such strategies we can give you. The beauty of therapy is that it's not meant to go on for the rest of your life. It's meant to give you some strategies that you can practice at home and move on. And if we can get there earlier, the less time we need to erase bad habits or help the child through any anxieties that develop, because that is a big part of feeding, is a lot of fight or flight and anxieties that develop. So if your child is worried about eating, if your child gags, or a lot of parents will call it choking, it's not always actual choking, but if they gag or retch or vomit while they're eating, those would be red flags. If you find that your child just doesn't seem to know how to bite through things or chew, there could be some oral motor challenges, and we could give some exercises to strengthen the oral musculature. Those would be the top red flags. Or if you just have a very limited diet, that would be another red flag.
Yeah, no, and I would counsel people to err on the side of caution and involve us earlier, because it's a lot easier as these things come up, right, to address them early in the process versus later. It's going to be more work. And at the end of the day, it's like, the work you do is amazing, but you're really equipping them with the tools to handle this themselves. Because really, even with a consult, maybe once or twice a week, and I think there's a myth or a misunderstanding what the consultation is and what it means. And it's the idea is for them to be able to handle these problems and to give them the tools and to give them the information that they need to be able to do that. And it's hugely, hugely appreciated from us, because I know how much help is provided to the kids that we've referred over, in a much better place they end up because of it. So on that note, I want to thank you, because this was awesome. And we should absolutely do this again, because I am sure after this, there will be more questions from families. And this is a topic, to me, it's like, it's not uncommon to have 7 or 8 families in a day ask me questions about this stuff.
Yeah.
And so there's still a lot of myths and a lot of misunderstandings out there related to introducing solids and getting toddlers to eat. And we haven't even hit on the older kids. That's a whole nother, our older kids. But thank you. I really appreciate the good work you guys are doing at Children's Therapy Center. Anything you want to let us know about you guys in terms of how they can reach out to you?
Sure. Our center is open, like I said. We have 4 different centers. We have a Springfield office, which I'm currently in. We have a Sterling office, a Gainesville office, and a Falls Church office, which we just opened a year ago. And we are all open with limited hours as we're, building back up for office visits, but we are also doing telehealth. Both are available for feeding therapy. If you're interested, just give the office a call. We take insurances, so just let us know your insurance and we can verify that, that's one of the insurances we take. And we can set you up for evaluations and treatment. We do ask for a doctor's prescription, so please consult your doctor.
We can do that.
and bring that with you for the evaluation. And we as well will communicate with your doctor and send our reports to them so they know what's going on as well.
And I got to say thank you for that, because that is something you guys do it really timely. I appreciate that, because we want to be as much involved in the care and know what's going on with the patients. Not everyone does. So it is a sign of a good practice.
That is great to hear. We believe in the team approach. So
absolutely. Well, thank you. I want to appreciate you doing it, and we'll definitely have to set this up again down the road and talk about some of the other issues. So have a great week, and thank you.
My pleasure. Take care.
Bye.
Bye-bye.
All right, guys. I'm gonna take her name off there. So, and again, if you're needing a referral, we'll certainly do that for you. And if you didn't get the information, I'll try to put that on our Facebook as well, and get you that information about Darcie and the Children's Therapy Center as well. They actually don't just do occupational therapy. They have physical therapists. They do a lot of other things there as well. This just happens to be one of the amazing things that they do, and they do really, really well. So we have gone probably over our usual time. I want to say thank you for you guys being here. I hope this was useful. We'll be posting this on our YouTube, as well as putting it up on our blog, on the video blog on the website. Those are absolutely resources. Any of the past Facebook Lives that you may have missed and wanted to catch or miss some information from them, they are put on our video blog that's on the website at einsteinpeds.com. And you can also find it on our YouTube channel. All right, guys. So until next week, have a wonderful week. Stay safe. I know you're all dealing with the school reopening stuff. I have a phone call at 1 to discuss with the Department of Health as well as the Department of Education. So I'll keep you apprised on what comes out of that. I suspect you're going to see things changing over the next weeks in terms of what's being said. I don't think anything's written in stone yet. And certainly things will continue to change. So stay tuned. I'm sure we'll have some Facebook Live discussions about that as well. If you do have questions about returning to daycare and school, we're a resource for you. You can certainly reach out through our patient portal, which is on our website. Or if you want a more lengthy conversation, we are doing telehealth, and we can certainly go over individually what's going on with your family and help you make that decision. On that note, have a great week. Thanks for being with me. And until next time, guys, be safe.